Hi, Dr. Angie, and welcome to the GI Health Summit. Thank you so much for being here.
Hello, Chef AJ. Thank you for having me.
Well, it's my pleasure. I really enjoy talking to you, Dr. Angie. I've interviewed you before for other summits, and I wanted to have you on the GI Health Summit because when I had you on the Truth About Weight Loss Summit, we had sent out a questionnaire to all the people that watched and asked them how we could help them eat a healthier diet, specifically a plant-based diet. And so many of them said the obstacle was that when they eat fiber, they don't feel good. They get bloated, and that was causing them not to want to eat healthfully. So how do we help these people that want to eat healthy, but just say, well, I can't eat plants. I get gassy, I get bloated, I get distended.
Yeah, so one of the things that I tell my patients is ease into it slowly. Perhaps you don't want to start off by eating a bunch of legumes. That's something that you would have to graduate into. And so start eating a lot of cooked vegetables, fruits, and then slowly you could increase the amount of fiber, especially raw vegetables, as you get used to it. And there's probably some kind of a microbiome basis on that. If you study South African or African populations where they naturally eat a whole food plant-based diet or mostly a whole food plant-based diet and compare their stool and the biome that is found in this stool with the stool of people in the United States, it's completely different. And we know that the digestive enzymes that come from the stomach, the duodenum, and the pancreas have little to do with digestion. Rather, the gut microbiome is doing most of the digestive process. So what happens is when you give someone who's naive to the plant-based diet a whole bunch of fiber, then their body doesn't have the mechanisms to break it down. So it ends up causing bloating. Perhaps it's not the right gut microbiome diversity. We don't know exactly why, but it is what it is. And so we ease people into it. But if you look at the biome of people in places where they eat a whole food plant-based diet, you'll see that they have biome that breaks down plant cellulose. And that biome is missing in the GI tract of people who eat the typical Western diet. And, you could kind of change the population of your gut microbiome by eating a diverse whole food plant-based diet. You can train your gut to be able to break down that plant cellulose, but perhaps it takes time. And so somehow this biome has to grow and thrive in your gut. And the way to do it is by eating a whole food plant-based diet, but slowly get into it so it's not causing you miserable gas and bloating.
So how long would you anticipate it would take? Because, people just don't want any discomfort whatsoever. I ate a bean once, I got bloated, forget it.
It takes some time, I tell you, some people do it within a week or two. Some people convert within 6 months to 8 months. It just depends. But I can tell you that if anyone came to me and said, I never get bloated, I would tell them that you have a bad short-term memory. There's no way. Everyone gets bloated. There is no way that you don't have any gas in the body. There's no way that you can tell me that you've never overeaten in your life. I mean, if you overeat, you get a little distended. That's just the stomach is full of food, and until that all gets broken down, it takes time. So you can get a little bit of distension. If you eat, for example, foods that have to get fermented, you will have a little bit of gas production, but embrace that. I mean, it's okay to have a little bit of bloating, meaning a temporary amount of gas in your gut, which will manifest itself as either burping or flatulence. It's not good and it's not convenient if it's all the time and it's excessive. But no one could tell me that they've never had gas. And flatulence is quite healthy because that's where when you ferment foods, the biome ferments food, there is gas production, and that has to go somewhere. Some of it diffuses through the wall of the GI tract and gets exhaled through the lungs. It goes through the circulation and gets exhaled through the lungs. Some of it gets passed through flatulence, and some of it comes up and it ends up being that people burp. But it's common whether you're eating a lot of plants or not, you're going to have fermentation.
I think people get embarrassed by this sometimes. I mean, unless you're a teenage boy, people get embarrassed by it coming out one end or the other.
Yes. And especially when they start eating healthier, they're eating more plants, they get a little bit more of that fermentation. and they get even more embarrassed because, okay, now they have a little bit more gas. But my thing is, I always tell my patients, embrace it and just kind of slowly ease into it. And remember that it's not the end of the world. You'll have a little bit of gas, but eventually your body will get used to breaking down the fiber, and it'll go away slowly.
Some people say that it's so bad they're distension, and I've seen photos where they literally, even men, look like they're 9 months pregnant. That's a little bit more than a little bit of gas, isn't it?
Yes. And then guess what? If it's that excessive, then one would have to wonder, why do they have that kind of an excessive bloating? So what does bloating mean? Okay, so what's the definition of bloating? Well, people use that term loosely. A lot of people say I'm bloated when, it's just, and then people interpret that as gas. But so when someone comes to me with bloating, I evaluate it very carefully. There are people who come in and have subcutaneous fats due to weight gain, and they call that bloating. Is that bloating? I don't know. Not in my definition. My definition of bloating is not abdominal fat. So how do you know that you have abdominal fat? Well, if you pinch it and you can pinch the fat between your fingers, that's obesity. Or subcutaneous fat, that's not really considered bloating. It has a bloated look, but it's not bloating. Other people come and they have mesenteric fat. That's fat that's inside the abdomen. It's called visceral fat. And that usually comes by when you gain a lot of weight and you're eating the standard American diet, you're drinking beer and like alcohol. So a poor lifestyle can give you mesenteric fat. People look pregnant in that case too. And I've seen women that way. You know the men with the beer belly? Is that bloating? It could be. It depends on how you define bloating, but that's just mesenteric fat, right? And then when they eat, they get even more distended, and that becomes more uncomfortable. But the actual reason they're that bloated is because of the mesenteric fat. Then you have people with fluid in their abdomen called ascites. They call that bloating too. That's a really bad thing. If you have ascites, get help. Then there's this other bloating, the type of bloating that is associated with IBS and SIBO. That's the kind of bloating that comes and goes. People often say, I wake up in the morning with a flat stomach or a flat belly, and as soon as I eat, I get bloated and distended. That's usually IBS, SIBO. That's a functional GI disorder. And generally speaking, doctors call that bloating. Do you see what I mean? So just because the abdomen is distended, that doesn't mean it's bloating. Even if you're constipated and your bowels are full of stool, you can get bloating. So there's different definitions of bloating, so you have to dig into it. If people are having gas distension, or after they eat, they get super bloated, that's usually a functional GI disorder that needs to be talked about. So what do people do? Naturally, they avoid fermentable fibers. Naturally, they avoid the beans. Why? Because if they eat beef, even though it's not healthy, or if they eat bacon, even though it's terrible, they won't get as bloated, right? So they go for, they try to fix that immediate bloating problem because they know if they ate broccoli, they're going to get super bloated. They will avoid it, and they'll eat bacon and give in to the long-term consequences. Do you see what I mean? So if you're getting gas and bloating, you have to figure out why. That's where I always want to dig in and find out why. So if you don't get to the why, even if you try to ease into eating fibers and introducing it slowly, you're still going to end up having problems.
Yeah. Well, very few doctors, even many GI doctors, don't even ask their patients what they're eating. And they often, what they refer them to is either a low FODMAP diet, a low residue diet, a low fermentation diet, one of those kind of diets.
Right. Which is terrible. We all know that a low FODMAP diet was only tested and recommended for 6 weeks. Band-Aid therapy, and basically doesn't have any doesn't have good long-term positive effects. Perhaps it could have deleterious effects because it could diminish the gut microbiome diversity. So it's a terrible idea to do a FODMAP diet. And some may say, well, I'm miserable and I just want some immediate relief. Great, but it's not sustainable. Don't do it after 6 months. Yes, you're going to get a little bit of relief, but what now? Who has gone to the root cause of your problem, and what are you going to do about it?
So what can we do to optimize our gut microbiome and our gut health in general?
So that's a really good question. I mean, optimization is one question, and solving the problems of the pathology that's going on is another question. So if you're talking about a normal, healthy person like myself, I want to optimize my gut. What I would do is I would eat a predominant whole food plant-based diet. um, I eat a vegan diet, and I would say about 90% of it is whole food plant based, which is SOS free. Um, but what I would do is I would recommend someone, besides diet, live a healthy lifestyle, exercise daily, try to not stress. It's very common in our society to um, work ourselves to death and not relax and have anxiety and depression and all kinds of stuff, which everything's related. So live a healthy lifestyle, exercise, meditate, just eat healthy, avoid alcohol, avoid cigarette smoking, all of those things that are common sense that we just don't do. Like I had a patient today. She says, I was partying and I drank a whole bunch of alcohol, and since then my gut's been really upset. And she's whole food plant based. She went whole food plant based because we were trying to treat her inflammatory bowel disease. But here's the thing: like, you're eating whole food plant based, but you're drinking excessively. That could alter the gut microbiome. So optimization means living a healthy lifestyle every day of your life as best as you can. Even I will drink once in a while. Even I will, I'll eat a cupcake with sugar and oil. But what I would suggest is to keep that to the minimum. Try to, on a daily basis, live a good, healthy lifestyle. And that's what I would do to optimize the gut. But then there's pathology, and then it's more than just optimization, meaning you have to get on to diagnose the problem, get to the root cause, treat the root cause, stabilize someone, then ask them to continue that type of a lifestyle for optimization. So, and everyone falls into a certain degree. It's a spectrum, and not everyone's at the same level, right? I've had patients who've been alcoholics their entire life. It's gonna take a lot of work. They basically have a really poor gut microbiome diversity. They have probably leaky gut, pretty bad leaky gut. I mean, there are a lot of problems. So, can you get them to eat a whole food plant-based diet within a week and everything's going to go away? No. We have to be realistic. So there's degrees. I have patients with inflammatory bowel disease. Is it going to help for them to eat a fiber-rich diet? Of course. But can they cure themselves? Most of the time, it's not that easy.
You mentioned root cause. Do you find there's a common denominator in a lot of your patients for many of these diseases?
Yes. I mean, most people I've met have had a terrible diet for many years, right? That's one thing we have in common. We live in a society where most people eat badly and they don't even know that they're eating badly. Just today, I spoke to a patient of mine, and I asked her, I made a general statement, said, how is your diet? She said, I eat a great diet. I wake up in the morning and I have eggs with honey. And then in the afternoon, I have some kind of a protein. And by that, she means a piece of meat, of course, which I hate that when people say I eat protein. I mean, kale has protein. What do you mean by protein? And then I eat some coconut oil and ghee, and anyway, she went on and on and on, and some vegetables. So the definition of a healthy diet is it's subjective. And so people grow up eating terribly and thinking they're doing a good job. So that's one thing, right? We live in a society where people drink a lot, excessively. People drink a couple of glasses of wine every day. And I see my patients have problems with that, and they think that's normal. And maybe every 5 to 6 weeks, they take a bunch of ibuprofen because they have headaches. And then they get a sinus infection and they take a bunch of antibiotics. So you see what I mean? There's like repeated damage, repeated insults. Like you keep repeatedly insulting your gut microbiome, your gut, it's going to cumulatively end up being enormous. And we don't realize it as we're doing it. We think, oh, it's just a little Advil once in a while. Oh, it's just a couple of glasses of wine once in a while. And it's a little bit of In-N-Out burger here and a McDonald's burger there. And it cumulatively, after 30 years of life, they become my patient. Do you see what I mean? So I think lifestyle is what I see as a common denominator, which people really need to take seriously.
Yeah. Like Dr. Clapper, who's an expert on this summit, talks about how your body is never not looking. So it looks like over time, these transgressions really can add up to poor gut health.
First of all, let me talk to you about how much I love Dr. Clapper. Isn't he sweet? Isn't he the best ever? I just love him. That man is so amazing. Wisdom, just amazing. I just love him. And he's the one who opened my eyes about the dairy, and I really looked into it. But anyway, I want to make sure that whoever is not following Dr. Clapper, please do. Basically, that's absolutely correct. I mean, even these little damages that we cause to the gut end up being tremendous.
Yeah, absolutely. So why are animal products in general and dairy in specific so deleterious to our health, but also to our gut?
Good question. So dairy is by definition a milk or a fluid that comes out of the breast of a mammal to feed their young, and it's designed by nature to fit that species. For example, my mother's milk was fit for me as a human baby, whereas a baby calf would drink cow's milk, and a sheep would drink their own mother's sheep milk. So the design, the protein content, the fat content, the hormones are all designed to fit that particular species. Is it okay for us to drink, so in our country, we usually consume cow's milk, right? So let's talk about not just any dairy milk. We're going to talk about cow's milk, which is generally referred to as the dairy with the dairy cows. So is it okay? Well, it won't kill you, but I can tell you it's terrible for the GI tract and other systems. Why is that? Well, since it's not designed for us, it turns out that the lactose sugar that's in milk is not very well digested by a human adult. So it turns out that anywhere between 30 to 99% of people can be lactose intolerant. So why is there such a range? Well, Caucasians have some kind of a mutation, like the Northern European people have some kind of a mutation where they have learned how to break down dairy. So a lot of the tall, white, Caucasian people will totally be able to break it down, no problem, because they have enough lactase enzyme to break it down. But you go to the African countries, you go to Asian countries, there's like up to 98%, 99% lactose intolerant. These people look at milk and they get diarrhea. And so what happens is, generally speaking, there's about 65% lactose intolerance in the world. So if something out there hurts 65% of the population, would it make sense for all these, for the government to advertise it as health food? I think it should be illegal to be sold as a health food. It should have all kinds of warnings. You may get diarrhea, bloating, gas, heartburn, reflux, all kinds of bad stuff, and cancer. It should come with those labels, yet it's sold as health food. Why? Because it has calcium. Okay, just because it has calcium, it doesn't make it good. You have to weigh out the risks and the benefits, and the risks way outweigh the benefits. So the lactose sugar is one thing that is terrible for the gut. The other thing is it's got a ton of saturated fat. Like a block of cheese is full of saturated fat. There are some animal studies, mammalian animal studies, that show clearly that when you eat a lot of saturated fat, there is a huge amount of inflammation caused, and it severs the bonds between the cells referred to as tight junctions. And when these bonds are severed, the gut becomes leaky. So the saturated fat is not so good if you're eating a high saturated fat diet, and that's predominantly found in cheese, right? So, and butter, of course. The other reason is I found, Chef AJ, many of my patients are allergic to whey protein and casein protein, which are the two main proteins found in dairy milk, in cow's milk. And what happens is some of my patients who come to me with difficulty swallowing, otherwise known as dysphagia, end up having this condition called eosinophilic esophagitis, tightening of the esophagus because of their allergies to dairy. So there are a few reasons. I don't think that these proteins are meant for human consumption. I don't think the sugar lactose is meant for human consumption. I don't think that level of saturated fat is normal to consume on a regular basis just because it has calcium, So yeah, I mean, I'm not saying don't drink milk, just drink plant milks like soy milk, which has plenty of protein. And if you're obsessed about the protein, if you can have cashews milk, coconut milk, hemp milk. I mean, there are 1,000 different types of milks. I'm just saying substitute with the healthier alternatives. And a lot of the vitamin Ds, just like cow's milk is fortified with vitamins too, by the way. It's a highly processed situation. And people think that, milk is not processed. It's not a whole food. It's totally processed. But, even soy milk, which I give to my son, is fortified with vitamin D. So, I mean, and it's full of protein. So, I really don't think in this day and age anybody should be consuming that disgusting stuff.
Yeah.
And imagine the dairy industry. These cows are being, the milk industry. Like there's milk coming from thousands of different cows all being mixed in one batch, and who knows which one was sick, which one was healthy, which one was was exposed to some kind of an illness. I mean, gross. It's kind of like when you eat I don't know, like meatballs or ground beef that came from 70 or 80 different cows being raised in these filthy conditions in these CAFOs, continuous, what is that called? And a continuous animal feeding operations, which are like they fit 100 to the dairy industry, by the way, is very commonly they participate in this. They fit like 100 to 1,000 animals in tight spaces. They live on top of each other, and when you study the soil and the runoffs close to these CAFOs, they've got antibiotics, they've got hormones, they've got toxins, they've got ammonia, and they've got superbugs because there's antibiotic resistance, and there's rat infestations and fleas and bugs that carry all these pathogens all over the place. And the milk is coming from all these cows that are living in these filthy conditions. Now, are you really going to drink that and think that you're going to be healthy? I don't think so,
And you mentioned antibiotics. When you're ingesting animal products or dairy, you're also ingesting antibiotics because they were fed the antibiotics.
Correct. Absolutely. And you can't raise animals in these filthy conditions and not give them antibiotics.
Yeah. So. I've heard you say in a few podcasts that some of your patients just stopping dairy, their symptoms improved.
Yes. I mean, so a lot of people are diagnosed with irritable bowel syndrome with diarrhea or with constipation or mixed. And they come to me and I find out they had lactose intolerance. I mean, 2 times 2 is 4. If you have, I know, 60% of the population is lactose intolerant. So my first initial thought when I meet a patient with IBS symptoms is stop eating dairy. And a lot of people will say, I don't eat dairy. And then you dig in and they're like, well, yeah, I'll have ice cream once in a while. Well, I don't drink milk, but I have yogurt. So, when you dig, and I eat whey protein powders to work out. So you see what I mean? And it's hidden in all the packaged foods. So you've got to be careful. It's really hard to avoid dairy. You really have to look for the signs.
And people seem to find it very difficult. They have a very strong attachment to it.
Yes, I mean, they grew up with it. Doesn't make it right because, I think about my poor parents. They didn't know anything about nutrition. How would they have known to give me soy milk or hemp milk? These things weren't even available back then, right? And so, we grew up with it, and it is what is indoctrinated in our culture to include the cheese and the milk for calcium. And if you ask people, well, do you know what else has calcium? They'd look at you like, no. So the advertising by the dairy industry wins because they've done such a great job, with their advertising to associate dairy with calcium, right? They've done a good job, truth be told, right? And so, they've done a good job, and that's it is what it is. Now we have to undo and help unlearn that the bad behavior.
Right. And there seems to be this addictive component, especially where dairy products are concerned.
Well, yeah, that casein. If you haven't read one of my other idols, Dr. Barnard, if you read The Cheese Trap, he's another fantastic doctor to follow besides Dr. Clapper, which we just talked about. Dr. Barnard wrote a book named by the name of Cheese Trap, and his recent books talk about hormones and things like that. But it indicates that the casein changes to casomorphones, which is like morphine products, which are very addictive. And it's really by nature is supposed to bring the calf back to latch again and drink more milk. But in our case, it leads to obesity and metabolic syndrome.
Well, there's some people that got the message about not consuming dairy, but they're still consuming animal products. They'll be on a diet called the keto diet or the carnivore diet. These are basically fiberless diets that can't be good for our gut.
Oh, well, no. I mean, there is research indicating that a predominantly whole food plant-based diet is very protective against polyps and cancers. It is important for the gut microbiome diversity, and a fiber-rich diet is healthy in regards to building back these tight junctions that may have severed in the gut. In any way you slice it or dice it, a whole food plant-based diet is superior. Well, I don't know if you can say superior because we have never had head-to-head studies between the whole food plant-based diet versus the carnivore diet. Versus the keto diet. I mean, there's no study like that. However, if you look at the weight of the literature, it's very obvious that a high fiber diet is very beneficial for the gut. A carnivore diet is definitely low in vitamins and definitely doesn't have much fiber at all. And I would highly discourage people from eating that way. An omnivore keto diet is very high in saturated fat, and it is I think it's a horrible diet for the gut and for the rest of the body, in my opinion, and should not be consumed. A vegan keto diet, which a lot of people like to follow, is much healthier than, because it still contains a lot of fiber, much healthier than the regular keto diet, obviously. And then, of course, if you just eat a well-designed, balanced whole food plant-based diet, is where you're getting the omega-3 fatty acids, which are proven to help the gut. You're getting the fiber, which is supposed to help the gut microbiome diversity and help the tight junctions. And it's low in saturated fat, which could hurt the tight junctions. And so anyway you look at it, even though there's no head-to-head studies between the diets, the whole food plant-based diet wins.
These people that are on these virtually fiber-free diets, how are they even pooping? I don't get it, how they're ever going to the bathroom just eating a bunch of meat.
Just because you don't eat fiber, it doesn't mean that you can't poop, because there's something called peristalsis, and you will still, the neurological action of the colon will dispose of waste products. And some of them, they have diarrhea actually because they're unhealthy. They're pooping, but they have diarrhea, which is not healthy, right? They're just pooping. Some are very unhealthy and they come to me with disease and they have inflammation. They may not be constipated, but they're infected. It's interesting because, Chef AJ, 10 people could make the same mistake and all 10 people come with different symptoms. There's genetic predisposition, whereas, for example, you and I are brunette, somebody else is a blonde, someone else has high cholesterol, someone else has low cholesterol despite a bad diet, someone has diabetes despite diabetes despite eating well, someone else doesn't despite eating poorly. There's genetic predisposition. So, if you look at people who are, so on average, if you look at populations who eat a low fiber diet, they have constipation. So that tends to be the predominant symptom of a low fiber diet. But not everyone who avoids fiber will have constipation. In fact, interestingly, people who eat an omnivore diet, they're eating a bunch of meat and dairy. They come to see me and I ask them to stop eating dairy and they get highly constipated. You see what I mean? Because now they're eating a bunch of meat without the dairy. The dairy was causing diarrhea and they're eating meat which causes constipation. Put it both together that you have normal bowel movements. You know what I mean? So there's so much variability, but you don't want to go follow some Instagram non-scientific quack who says eat a carnivore diet. It's just 1% there's some kind of a secondary gain, or maybe they're psychotic, I don't know, but they're not promoting the scientific literature. They're just talking out of their what. So generally speaking, I mean, you want to talk to doctors who are evidence-based. They're speaking based on the scientific data rather than in my experience, Chef AJ, when I ate a carnivore diet, I did great. I did really wonderful. I mean, who cares about my experience? I don't count as a person. What counts is a randomized controlled trial, right? A population of, with placebo control. That's what's important.
Yeah. And you had mentioned colon cancer to be on an increase in this country, not only the number of people getting it, but the age of the people getting it seems to be decreasing. And yet in other countries, it's very rare.
Yeah, I mean, I really haven't looked at the data in other countries. However, in areas where they eat predominantly a whole food plant-based diet, there's very little diverticulosis, colon cancer, and they don't even need screening tests for colon cancer. In the United States and some of the Western countries, so in the US for sure, colon cancer is the second biggest cancer killer in both men and women. And recently, we noticed that although the incidence of cancer is going down in people over 50 because of intense screening, it's going up in the younger, who are younger than 50. And so that's why I got my screening colonoscopy at age 45 myself. So why is it rising? Well, because people are eating badly, right? They're eating a omnivore diet full of processed meat and red meat, and they're not getting screened. So that's why we are now recommended to screen patients at age 45. But interestingly, you could keep decreasing the age for screening. Maybe in 10 years it would be 40, and then after that it'd be 35. Everyone at age 10 should have a screening. I mean, it could steadily keep dropping, right? So the goal should not be to aim for screenings sooner and sooner. The aim should be to eliminate colon cancer as much as possible and limit it to only cases that are inherited. Inherited colon cancer cases are only 5% of the cases. 95% comes from a bad diet and environmental causes, right? Like alcohol, cigarette smoking, processed meat, a lot of meat in general, low fiber, sedentary lifestyle. So I think what you're doing right now is great, because instead of basically telling people get screened, you're saying, yeah, get screened, but also eat healthy. You see what I mean? Because that's how you can prevent problems in the first place.
Absolutely. So when you're doing a colonoscopy and you see a polyp, how long did it take for that polyp to grow and get to be big enough so that you can remove it?
No one knows exactly. And most polyps grow slowly. It takes like 10 years for a polyp to grow. So if I'm doing a screening test on a 50-year-old, that polyp was it started coming out in their 40s. And then at age 50, it's significant enough where I can see it and I'm removing it, right? And so polyps are very slow growing. Nevertheless, colon cancer screenings are absolutely important. But one thing to remember is you don't have to do a colonoscopy to do cancer screening. There are stool testings that are super simple. So when I'm promoting screening, I'm not promoting colonoscopy per se. If you have a lot of people get stool testing, and that should suffice. But do get a form of screening test, because colon cancer is the second biggest cancer killer in the United States. And do eat a whole food plant-based diet, but continue getting your screenings. I see a lot of people who don't get screened and they get cancer. I've seen vegans, a 13 years vegan, who came to me who had colon cancer. So colon cancer can still occur, but your risk will be a lot lower.
Yeah, great. Thank you. Why is fiber so important for our health in general and for our microbiome in particular?
Well, the healthy biome that lives in a symbiotic relationship with you thrives off of fiber. Mouth to anus, there are 100 trillion organisms. Biome, we should call it the biome, not or microbes, not bacteria, because there are different types of biome living in our gut. The majority of them live in the colon, and some live in the small intestine, and some in the stomach, and some in the esophagus, and some in the mouth. Collectively, they offer 100 times more genetics than our own eukaryotic cells. So it's important to keep them happy. And in order to keep a good, diverse gut microbiome, you must eat a good, diverse diet, a healthy, diverse diet. So the gut microbiome diversity, which is important so a healthy biome is a diverse gut microbiome. And how does that come? That comes from eating a variety of fruits and vegetables, nuts, seeds, grains, and legumes. So the more variety, the more diverse is the gut microbiome. Now, if you are eating an omnivore diet and you have a lot of fiber and you're eating a little bit of meat, your biome may actually be healthier than someone who's restrictive vegan and only eating 2 things. Do you see what I mean? So just because you're vegan, it doesn't mean you're going to have perfect gut microbiome diversity. So a gut microbiome diversity comes from eating a diverse types of fruits, vegetables, nuts, seeds, and grains. Now, if you want to do the perfect thing, I would say, we'll just eat a whole food plant-based diet, 100%, and make sure you're eating as diversely as possible, right? That's the best case scenario. But these gut microbiome they need to eat too. Right? If you starve the gut microbiome, especially the fiber-loving gut microbiome, the ones that want to eat fiber, if you starve them, they will start eating up this mucus layer that's in the gut, where the gut microbiome, and so there's the cells of the gut, and there's like a little mucus layer that's protective that overlies the cells, and then on top of that is the gut microbiome. So there's like several layers, and so here's the cells, here's the gut microbiome. In between is the mucus layer. And if you starve these fiber-loving gut microbiome, they start digesting that mucus layer, which is full of basically proteoglycans, and they start eating it up. And so then your gut gets susceptible to inflammation and infections and all kinds of things, right? So you don't want to starve your gut microbiome. And they thrive off of fiber. And so when you eat the fiber, what happens is the gut microbiome is happy because they're taking this fiber, producing short-chain fatty acids, which are helpful in the immediate sense because they repair that damage and repair the gut lining, but also traverse the gut and find themselves inside the circulation and circulate. And that's when it's important, because through a hormonal effect, these short-chain fatty acids are important for the brain, for the muscles, for everything, for the rest of your body. So it's their action is not limited to the gut. They actually traverse the gut and go into the circulation, and good for your cells head to toe.
Oh, thank you. What's the chief complaint of the patients that see you?
Constipation, diarrhea, blood, hematochezia, which means blood in the stool, blood in the vomit, nausea, vomiting, hematemesis, which is blood in the vomitus, difficulty swallowing, abdominal pain, constipation, bloating. I mean, those are some of the common ones. And of course, there's 1,000 more.
It just seems, I don't want to say everybody I know, but I know so many people now that have IBS and SIBO. And a few years ago, those words were not, you didn't hear them so often.
Well, exactly. And, SIBO is a relatively new diagnosis. And we all have only known about the gut microbiome for a couple of decades, really. This is a new and emergent field. And I can tell you that a decade ago, when I was being trained in residency, I don't even remember them focusing on SIBO. We talked about IBS in fellowship, but we didn't even get trained on how to treat SIBO very well, because it was, first of all, I think the training programs, we focus on really awful killer diseases. Like, you see the sickest of the sick. So really, someone has bloating, that's the least of their complaints. They're going to lose limbs, they're going to lose their heart and the brain. And so in training programs, the training in regards to SIBO and IBS is a little bit limited most of the time. And then the field is emerging, and our knowledge of SIBO is increasing slowly. It may not be fast enough because it's a very common problem. And now we think that maybe IBS and SIBO could, in some instances, be the same disease. So whereas in the past we used to call it IBS, now we know that there's perhaps concomitant SIBO, and we used to call it IBS. So the awareness is going up, and there's more literature being written, there's more testimonials being written, and now you have Instagram, people showing their bellies all the time with the bloating, and we didn't have that before. So there's more complaints about it, and there's more awareness about it, and it's more talked about. So it makes it seem like there's more, but SIBO IBS has been around for a long time. It's just there's more awareness.
So should everyone that has gas and bloating see a gastroenterologist and ask to be tested for SIBO?
It just depends. Remember, gas and bloating is a little bit of, it depends on bloating. If you're talking about abdominal distension created because of eating, that comes and goes, and if it's uncomfortable and it's causing a poor health quality of life, yes, of course, you should see a gastroenterologist. But a little bit is totally normal. You're allowed to have a little bit of bloating and gas. But like I said, if it's excessive, yeah, I think so. I think people should see a gastroenterologist, and they should see somebody who preferably understands nutrition, or see a gastroenterologist and a dietitian, because I think that's important to look for the underlying cause. Because just to say you have SIBO, get it treated, that's not enough, because it'll be a recurrent problem. I've had that happen a lot, where people come to me and they took rifaximin 3 times and they're still having bloating. And then what? I mean, you can't just throw antibiotics at people and not find the underlying cause. If you do find the underlying cause, if you can find the underlying cause, that should be the emphasis, rather than throwing antimicrobials at it.
Nice. So many people I know, even vegans, seem to suffer from gastroesophageal reflux disease, and they're taking medications or sleeping with their bed on bricks. And I know that a lot of them, when they go from more of a junk food vegan diet to a whole food diet, maybe without the sugar and the oil and the salt, it seems to improve. Do you find that to be the case with your patients, that what they eat matters?
Certainly. I mean, imagine if I was a junk food vegan. You and I know that you can get 60% of your diet could be fats very easily. And if you're eating vegan, it's not high cholesterol, but it's high in saturated fat. Like if you're on a vegan keto diet, you could easily have 70% of your diet as fat. And so it's the thing is that there is a sphincter between the esophagus and the stomach that loosens with fat, with a high fat diet. So it allows for the gastric juices to go up into the esophagus. And that's what's called gastroesophageal reflux disease. And so basically, just because someone's eating vegan, it doesn't make them healthy. You can be on a high-fat vegan diet, drink alcohol every night, that's vegan, and smoke cigarettes, that's vegan. And you will have gastroesophageal, and be obese. And, so that's like a perfect recipe right there for GERD. Yeah, it's interesting because a lot of people think just because they've been vegan, they're going to be fine. Veganism is not a way to eliminating disease or preventing disease for every single person in the population. There's genetic variabilities. There is the type of vegan diet matters. If you're eating whole food plant-based, it's way different than vegan. So So yeah, I mean, the fat content in the food is important, and that kind of relaxes. The high fat diet relaxes the lower esophageal sphincter, and acid could come up and cause reflux. Some people have a problem with their lower esophageal sphincter where it just loosens, and they get lower esophageal sphincter relaxations. And going whole food plant-based or vegan doesn't help that. Some people can have a hiatal hernia, and half of their stomach is sitting in the chest. Going vegan is not going to help that. So there are different causes, and it's important to start eating healthy, but also look for other causes that could concomitantly cause problems.
That makes sense. I've heard you mention that there's often a link between hypothyroidism and some of these GI disorders. Could you talk a little bit about that?
Yes, 30% of people who have hypothyroidism, SIBO patients, there's a high correlation of people with hypothyroidism who have SIBO. It's very commonly found. Now, who knows what came first, chicken or the egg? Did the hypothyroidism cause sort of a dysmotility in the gut, which caused SIBO? Or was it SIBO and the functional GI disorder that caused the hypothyroidism? I mean, no one really knows, but generally speaking, it's thought that hypothyroidism kind of causes dysmotility and slowing of the gut, which then causes SIBO. What else? I mean, there's hypothyroidism also affects the motility of the colon, and that causes constipation. So you could also have diarrhea. I mean, it's just there are very, very different kinds of GI problems that can happen when one has hypothyroidism, because the motility of the gut is important. The thyroid hormone has a lot to do with the motility of the gut, and if it's lacking, that affects the gut.
Thank you. What effect do hormones have on our gut?
Well, which hormones?
Well, female ones, I mean, it's particular.
Right. Well, there's definitely receptors for estrogen and progesterone on the gut. So I see that a lot of patients come in and they're pregnant during pregnancy. They're like, I didn't have any problems during pregnancy. Now I have problems, or vice versa. I didn't have any problems before pregnancy. I mean, there is definitely a correlation between the hormonal levels and the gut, because there is receptors for estrogen and progesterone on the cells of the gut. And as long as there's receptors for it, they're going to have an effect. So that's definitely common.
Thank you. Could you talk a little bit about pelvic floor dysfunction? Because that's something that I've just lately been hearing about that could be a cause for some of people's symptoms.
Pelvic floor, by the way, I'm by no means a pelvic floor specialist, but I know a little bit about it, and I'll share with you. So pelvic floor muscles get weakened as we age, and as our abdominal and pelvic floor muscles get weak, what we end up having dysfunctions in regards to bowel movement, bowel habits, and being able to control our bowels and bladder. So what happens in some cases also is the angle of the rectum changes, and that makes it very difficult for people to strain and have a normal bowel movement. So pelvic floor problems could be a problem with the angle of how the bowels are sitting. It could be with a with relaxing of the organs into the pelvic floor, meaning the bowel is pushed out, or the bladder is pushed out, or the uterus is pushed out. Or it could just simply mean weak pelvic muscles where people have incontinence without laxity. So there's different kinds of problems, but usually what it will manifest as is stool incontinence, meaning, you're walking around, you're 80 years old. Usually it happens in 70s and 80s and beyond, where, and by the way, if you're listening, it's bound to happen. And if you had kids, good luck, So one thing that happens is you get stool incontinence, and so the stool just kind of seeps out, and you may or may not be aware, and sometimes it gets to a point where the elderly have to wear diapers, and that's the laxity of the anal sphincter and the muscles. The other way it manifests, the urinary incontinence besides stool, so every time you sneeze or cough, you pee, and that's usually after pregnancy. Even young women get it. The other way it could manifest is if you have a weird angle of your rectum when you go to the restroom, you can't squeeze that poop out, where you have to like manipulate it with your fingers, push this and push that, and sit in a certain position to finally be able to evacuate. And if you have constipation on top of that, good luck, because it's hard pebble stools and you got to strain hard, and then you have this weird angle that just makes it worse. So anyway, those are some of the things that could happen.
Yeah, because I do hear from a lot of vegans that eat plants and lots of fiber, but still have constipation.
Oh yeah, I mean, again, it's funny because I get those messages all the time. Dr. Sadeghi, I'm eating a whole food plant-based diet. I still have this and that. I get it. Like, look, I don't want to sell you snake oil. I'm not saying you eat a whole food plant-based diet, all of your problems in the world will go away, including your marriage problems. I'm just saying, the eating a whole food plant-based diet is a very healthy option, which will prevent, most likely, better than all these other diets out there, which will protect you against disease and sometimes reverse disease, most of the time reverse disease, and protect you against all these chronic conditions. But yet, yeah, absolutely, there's definitely cases where, like, some people have Hirschsprung disease. This is a colon that doesn't have enough nerves in there, where it cannot cause peristalsis. And there's attenuated Hirschsprung disease, where the colon is missing the enteric nervous system. Like, good luck pooping. I don't care if you're vegan or, eat a super healthy diet. You're just not going to poop. That's just a genetic disorder, right? Let's just put it this way. Let's say you have hypothyroidism and your gut motility is terribly low. Even if you have, if you're on a whole food plant-based diet, the problem is not lack of fiber. The problem is lack of motility or dysmotility because of hypothyroidism. And there's idiopathic constipation, which means to this day, there are cases of idiopathic constipation, which we don't know what's causing it. There's no hypothyroidism. People are eating a whole food plant-based diet and they still can't poop. And it means that we just don't know. To this day, our knowledge is limited to properly diagnose it. So yeah, you could still, and in those cases, that's where, some vegans come to me and they're like, I don't want to take medicines ever. And I'm not going to take medicines. And then you look at everything. Their thyroid's great. They're eating a whole food plant-based diet. They're doing everything right. They eat organic. They never drink alcohol. They're living a healthy lifestyle. And they tell me, I don't want to take medicine. Look, I hate the pharmaceutical companies just as much as you do. But at some point, sometimes it's better to take something, because otherwise you won't be able to poop. I mean, I have patients who go for 10 days and they can't have a bowel movement. Imagine how much bloating you can get. And they come to me complaining on bloating, and you realize they're constipated, right? So what's normal? It would be great to have a normal sausage-like bowel movement without straining, without complications. You go to the restroom, it comes out, you're done, you wipe, you leave. That could happen once a day. That could happen every couple of days. Actually, everyone's like, people brag about, I go every day. Good for you. I mean, if you're a female eating 1,200 calories a day, you're not going to have a bowel movement every day. And that's quite normal. It's not about it's not about going every day. It's about when it comes out nice and smooth, looks like a sausage, and I didn't have to strain. Great. That's a type 4 on a Bristol scale chart, normal bowel movement. If it's pebble-like and hard and you have to squeeze really hard, that's constipation. If it's liquidy, soft serve, multiple during the day, that's diarrhea. And then another problem is, a lot of people, by the way, they don't eat fiber because they think if they have diarrhea, it's going to make them go even more. Now, here's so wonderful about fiber. Fiber actually normalizes the bowels. If you have constipation, it can help you have a type 4 bowel movement. If you have diarrhea, it's actually bulking. It bulks the stool, right? So if you have diarrhea or constipation, fiber is good for you. Now, try to find that in a medicine. Medicines can do that. Why? Because a medicine is if you're having diarrhea, you would have to take an anti-motility agent or some medicine that slows you down. If you're having constipation, you have to take a laxative, which will give you diarrhea as a side effect. So it usually overshoots the extreme side, on the extreme side of the spectrum. But fiber actually normalizes this. So people, even if you're vegan, I would suggest a fiber supplement is usually benign. Talk to your doctor. I'm not giving generalized advice here to get you in trouble or myself. You should see a doctor, establish with a doctor, but taking a fiber supplement generally is very healthy. And even if you're a vegan, a lot of times when IBSD or IBSC or functional disorders or whatever, that's one of the first things I do, even for the vegans. A fiber supplement can help stimulate the gut just because fiber is stimulating and bulks the stool. So if you have constipation, it helps. If you have diarrhea, it helps.
Nice. I'm glad you mentioned the Bristol stool scale because I'm a 4. Yay! I know what that is. What effect do substances like caffeine and alcohol have on our gut?
Caffeine, if not drank excessively, nothing. Caffeine is fine. If you drink it excessively, it could give you reflux because it lowers the tone of the lower esophageal sphincter and cause GERD. But a little bit of caffeine, if it's coffee, healthy brewed coffee, it's okay. I'm not suggesting you drink Red Bull. I'm saying like just a little bit of brewed caffeine, coffee. Alcohol. Well, alcohol can be extremely unhealthy for the gut. One of the most common diseases I see as a gastroenterologist is liver cirrhosis and end-stage liver disease. And the cause of it generally is either fatty liver disease because of unhealthy eating, and sometimes it's viral diseases like hepatitis, and most of the time it's due to alcohol. Well, not most of the time, but a majority of the times. So alcohol can have a very deadly effect on the liver if drank excessively. This is well documented literature that shows that excessive consumption of alcohol can lead to chronic liver disease and cirrhosis. Interestingly, hepatitis B, hepatitis C, and in particular hepatitis C and alcoholic liver disease were the most common causes of chronic liver disease in the past, but now it's actually fatty liver disease from a bad lifestyle and bad diet that is now the most common types of liver disease we see. So alcohol is definitely damaging to the liver if drank excessively. Now, we have now come to an era where the gut microbiome is taking the forefront of the research in the GI world, and we're studying the effects of alcohol, and drinking alcohol causes dysbiosis, which means an alteration in the gut microbiome balance, and can lead to SIBO. Okay, so and there's definitely research that's showing that it can cause leaky guts, which it means it breaks the bonds between the cells and cause leakiness. So I don't recommend the consumption of alcohol regularly. I know some people enjoy their wine once a day. I really think until we find that minimal dose of alcohol that can damage your gut microbiome that you can get away with, I would recommend against it.
Thank you. What effect, if any, does stress and anxiety have on our gut health?
The studies, the jury is hung on that. I mean, we know that the functional disorders of the gut are commonly associated with depression and anxiety, but who knows what came first? Like, we know that there's a brain-gut axis, and we know that they're connected. That is fact. Through the neurotransmitters, through the nervous system, through a hormonal regulation, the brain and the gut are connected. But we don't know that for sure stress and anxiety can cause IBS and SIBO, and we don't know for sure whether SIBO and IBS causes depression and anxiety. So there's a connection, and that it needs to be studied further. The jury's hung on that. We need more research on that. I don't think anybody could claim that they really know for sure.
Right. So, Dr. Angie, what is the truth about GI health?
The truth about GI health is that there are 100 trillion gut microbiome living in your gut, and they collectively have more genetics than your entire body, your cells of your body. So the truth is, if you keep them happy, potentially you will be healthier. What do I mean by that? Eat a whole food plant-based diet or a fiber-rich diet, and you're likely to have a healthy gut microbiome diversity and a healthier body.
Great. Thank you so much, Dr. Angie.
My absolute pleasure, Chef AJ, anytime.